When Lily Chen's homemade herbal remedy started shrinking tumors in the children's cancer ward, Dr. Richard Blackstone dismissed it as coincidence, until his own billion-dollar research team couldn't replicate what the sick 8-year-old had discovered in her grandmother's garden. The small girl with delicate features and a bright pink headscarf covering her bald head had been quietly sharing her healing tea with other young patients at Boston Children's Hospital for 3 months, insisting that the bitter-tasting brew made from plants she grew herself could help them feel better. Before we begin this beautiful story, please subscribe to the channel and turn on notifications. Now, let's get back to the story. Dr. Sarah Martinez, the head pediatric oncologist, first noticed the unusual pattern during her morning rounds. "Lily, your latest scans show remarkable improvement," she said, studying the chart with growing amazement. "The tumor markers have decreased by 37% since your last treatment cycle." Lily looked up from the small potted herbs arranged on her hospital windowsill, her 8-year-old face serious beyond her years. "It's not just the medicine from the pharmacy," she said quietly. "It's the tea I make from Grandma's plants, the ones that know how to fight the bad cells." Dr. Martinez smiled indulgently, accustomed to pediatric patients attributing their recovery to various personal rituals and comfort items. "Well, whatever you're doing, keep it up. Your response to treatment has been exceptional." What Dr. Martinez didn't know was that 3 other children on the ward had also shown unexpected improvements after Lily had shared her herbal concoctions. 8-year-old Marcus Williams, who had been battling leukemia for 2 years, was showing his first positive response to treatment in months. 10-year-old Sofia Rodriguez, diagnosed with a rare brain tumor deemed inoperable, had experienced a significant reduction in seizures. Most remarkably, 6-year-old Tommy Park, whose aggressive lymphoma had resisted every conventional therapy, was displaying tumor shrinkage that his doctors couldn't explain. 15 floors above the children's ward, Dr. Richard Blackstone stood in his corner office overlooking Boston's medical district, reviewing quarterly reports from Medicorp Pharmaceutical's most ambitious research projects. At 58, he'd built the company into a global powerhouse worth over $200 billion, with breakthrough cancer treatments that generated $30 billion in annual revenue. His latest drug, Oncozine, represented 7 years of development and $3.2 billion in research costs. But early trials showed it could extend cancer patients' lives by an average of 14 months. "The FDA approval process is proceeding ahead of schedule," reported Dr. Janet Foster, his chief research officer, as she entered his office carrying tablets displaying clinical trial data. Oncozine should reach market within 18 months, with projected revenues of $15 billion annually. Richard nodded, his attention focused on patent applications that would protect Medicorp's intellectual property for the next 20 years. "Excellent. Any complications from the pediatric trials?" "Nothing significant. Some patients are showing better responses than expected, but we attribute that to improved supportive care protocols." Neither Richard nor Dr. Foster realized that some of those improved responses were occurring in children who had access to an 8-year-old girl's homemade herbal remedies, treatments that were achieving results their billion-dollar laboratory couldn't match. Lily Chen had learned about healing plants from her grandmother, May Chen, who had practiced traditional Chinese medicine for over 50 years before immigrating to America. When Lily was diagnosed with stage 3 neuroblastoma at age 7, Mai had quietly supplemented her granddaughter's hospital treatments with carefully prepared herbal formulations, despite her son David's skepticism about mixing old country remedies with modern medicine. "Grandma, why do the doctors say my cancer's getting smaller, but they don't want to hear about your plants?" Lily asked during one of their afternoon gardening sessions in the small plot behind their Boston apartment. Mai carefully transplanted a young ginseng plant, her weathered hands gentle with the delicate roots. "Sometimes people only believe in what they can measure in laboratories," she replied in accented English, "but plants have been healing people for thousands of years before there were laboratories." Lily absorbed this wisdom with the seriousness of a child who had faced mortality before learning to ride a bicycle. "Could I help other kids like me? The ones who are scared and sick?" May looked at her granddaughter with pride and concern. Lily's natural intuition about which plants could help specific conditions had surprised even her grandmother. The child seemed to understand instinctively how to combine different herbs for maximum healing effect, often suggesting modifications to traditional recipes that proved remarkably effective. "You must be very careful," May warned. "The hospital doctors do important work too. But yes, sharing what we know about plants can help people." Over the following weeks, Lily began quietly offering her herbal teas to other children in the cancer ward. She was careful to frame them as friendship gifts rather than medicine, sharing stories about her grandmother's garden while sick children sipped the carefully prepared brews. The results were subtle at first: improved appetite, better sleep, reduced nausea from chemotherapy. But gradually, several young patients began showing clinical improvements that surprised their medical teams. The pattern became undeniable when Dr. Martinez compiled monthly progress reports for the pediatric oncology department. 5 children who had been sharing Lily's herbal preparations were responding to treatment significantly better than statistical models predicted. Their immune systems were stronger, their side effects from chemotherapy were milder, and most remarkably, their tumor markers were decreasing at rates that exceeded anything achieved by conventional protocols alone. "This is highly unusual," Dr. Martinez confided to her colleague, Dr. James Wright, as they reviewed the data. "These 5 patients have nothing in common except their assignment to the same ward. Different cancers, different treatment protocols, different genetic profiles, yet they're all exceeding expected outcomes." Dr. Wright studied the charts with scientific skepticism. "Environmental factors? Diet modifications? Family support variations? I've checked everything. The only common element is that they've all become friends with Lily Chen, the neuroblastoma patient in room 314. Dr. Martinez decided to investigate further. The next morning, she found Lily in the ward's play area, carefully tending to a collection of small potted plants that she'd somehow been permitted to keep despite hospital regulations about live vegetation. "Lily," Dr. Martinez said gently, "I've noticed that several of your friends have been feeling much better lately. That's wonderful news." Lily looked up from watering a small herb plant with delicate purple flowers. "They like my grandma's tea. It tastes funny, but it helps the medicine work better." Dr. Martinez felt a spark of scientific curiosity. "What kind of tea?" "Different plants for different sicknesses," Lily replied matter-of-factly. "Marcus gets the one with ginseng because his blood is tired. Sophia needs the flowers that help her brain stop hurting. Tommy gets the bitter roots because his bumps are very angry." The precision of Lily's descriptions sent chills down Dr. Martinez's spine. The 8-year-old was describing symptom-specific treatments that aligned perfectly with each child's particular medical condition. "Lily, would you be willing to show me how you make these teas? I'm very interested in learning about your grandmother's plants." That afternoon, Lily guided Dr. Martinez through her informal pharmacy, explaining the properties of each herb with knowledge that would impress botanical researchers. She demonstrated how she combined specific plants based on each patient's needs, adjusting ratios and preparation methods with intuitive precision. "This one," Lily said, holding up a plant with small white flowers, "helps the body remember how to fight bad cells. Grandma says it's very old and very smart." Dr. Martinez photographed each plant and documented Lily's preparation methods, her scientific training recognizing that she was witnessing something potentially groundbreaking. That evening, she researched the botanical names of Lily's herbs, discovering that several contained compounds being investigated by pharmaceutical companies for their anti-cancer properties. The following week, Dr. Martinez received permission to conduct informal monitoring of the children who'd been consuming Lily's herbal preparations. The results were undeniable. All 5 patients showed improved biomarkers, enhanced immune function, and better tolerance of chemotherapy compared to similar patients receiving standard care alone. Armed with this data, Dr. Martinez requested a meeting with the hospital's research board to discuss potential investigation into complementary herbal therapies. The request eventually reached Dr. Richard Blackstone, whose pharmaceutical company provided significant funding to Boston Children's Hospital's research programs. Dr. Martinez, Richard said during their video conference, his tone professional but skeptical. You're suggesting that an 8-year-old patient has developed herbal treatments that outperform our clinically tested protocols. I'm suggesting that traditional plant-based remedies might offer valuable complementary benefits when used alongside conventional treatments, Dr. Martinez replied carefully. The preliminary results are remarkable enough to warrant serious investigation. Richard leaned back in his executive chair, considering the implications. Medicorp had spent billions developing synthetic compounds that attempted to replicate the healing properties found in various plants. The idea that a sick child with no scientific training had somehow identified more effective natural formulations was both intriguing and threatening to his company's research model. Dr. Martinez, I appreciate your thoroughness, but correlation doesn't imply causation. These children's improvements could be attributed to numerous variables. However, if you believe there's genuine scientific merit to investigate, I'll arrange for our research team to analyze these folk remedies. 2 weeks later, a team of Medicorp's top biochemists arrived at Boston Children's Hospital with equipment to analyze Lily's herbal preparations. Dr. Elena Vasquez, the company's leading natural products researcher, expected to find simple plant compounds that might have mild therapeutic effects. What she discovered challenged everything she thought she knew about pharmaceutical development. Dr. Blackstone, Dr. Vasquez reported during an emergency meeting, this child has somehow created compound formulations that target cancer cells with precision we've never achieved synthetically. The active ingredients work synergistically in ways our computer models can't predict. Richard studied the analysis data, his business instincts warring with scientific fascination. Are you telling me that an 8-year-old girl has accidentally discovered compounds that our $200 billion research infrastructure hasn't been able to develop? Not accidentally, Doctor, Vasquez corrected. She's using traditional knowledge passed down through generations, but she's adapting and refining the formulations based on individual patient needs. It's personalized medicine using botanical intelligence that predates modern science by centuries. Richard felt the ground shifting beneath his carefully constructed business empire. If natural, unpatentable plant compounds could achieve better results than Medicorp's synthetic drugs, the implications for the pharmaceutical industry would be catastrophic. What would happen if we tried to synthesize these compounds? He asked. We've been trying for the past week, Dr. Vasquez admitted. Every synthetic version we create loses effectiveness. The healing properties seem to depend on the plants being grown in specific conditions, harvested at precise times, and prepared using methods that the child learned from her grandmother. Richard processed this information with growing unease. So these treatments can't be patented, mass-produced, or standardized. Not without losing their therapeutic value. It appears that the effectiveness depends on factors we don't fully understand: soil conditions, plant age, preparation timing, even the intention of the person creating the remedy. That evening, Richard made a decision that would test everything he believed about medicine, business, and human nature. He would meet Lily Chen personally and try to understand how an 8-year-old girl had achieved what his company's best scientists couldn't replicate. The next morning, Richard Blackstone walked through the halls of Boston Children's Hospital for the first time in his career. Despite providing millions in funding, he had always managed the relationship through intermediaries, preferring to maintain distance from the emotional realities of pediatric illness. He found Lily in the garden area that the hospital had created for patient therapy, carefully tending to a collection of plants that looked remarkably healthy despite being grown in containers under artificial lighting. You must be Lily, Richard said, approaching carefully. I'm Dr. Blackstone. I've heard remarkable things about your garden. Lily looked up with the direct gaze that sick children often develop, unafraid of adults, because they have already faced far more frightening things than intimidating grown-ups. Are you the man who makes the expensive medicines? She asked without preliminary pleasantries. Richard was taken aback by her directness. Yes, my company develops treatments for various diseases, including cancer. Lily nodded thoughtfully. My medicines help people too, but they don't cost money. They just need love and time to grow. Richard knelt beside her raised garden bed, studying plants he couldn't identify. Lily, how do you know which plants to use for different sicknesses? Grandma taught me the old knowledge, Lily replied, but the plants teach me new things too. They show me what they want to become and who they want to help. Richard's scientific training rebelled against such mystical explanations, yet he couldn't deny the clinical results he'd seen. When you say the plants show you things, what do you mean? Lily considered the question with unusual gravity for someone her age. It's like when you look at a person and can tell they're sad, even if they're smiling. Plants have feelings too, and sicknesses have feelings. I just help them find each other. Despite himself, Richard found Lily's explanation strangely compelling. Would you be willing to teach my scientists about your methods? Lily's expression grew cautious. Will they want to hurt the plants to see how they work? Richard paused, recognizing that traditional pharmaceutical research involved exactly that, breaking down natural compounds to isolate and synthesize active ingredients. They would want to understand the science behind why your plants are so effective. Science is good, Lily said carefully, but some things work better when you don't take them apart, like how a song isn't just the notes, or how a hug isn't just arms touching. Richard felt something shift in his understanding. For decades, he'd assumed that progress meant reducing complex natural systems to their simplest components. Lily was suggesting that healing might require preserving the complexity, not eliminating it. Lily, what if we could help more sick children by growing your plants in many places? Would that be good? Lily brightened at the possibility. That would be wonderful. But the plants would need people who understand them, not just machines. And the medicine would still need to be free for families who don't have money. Richard nodded, though internally he was calculating the business implications of non-patentable, labor-intensive treatments that couldn't be sold at premium prices. Over the following month, Richard found himself visiting the hospital regularly, ostensibly to monitor the research into Lily's herbal remedies, but increasingly drawn by his conversations with the remarkable 8-year-old. She challenged his assumptions about medicine, business, and the nature of healing itself. During one visit, he found Lily teaching 3 other children how to plant herbs in small containers. Everyone can learn to grow medicine, she was explaining to her attentive audience. Plants want to help people feel better. Richard watched as sick children, some barely able to stand, carefully placed seeds in soil with hope shining in their eyes. The scene was both beautiful and deeply troubling to someone whose wealth depended on keeping medical treatments expensive and exclusive. Dr. Blackstone, Lily said, noticing him watching. Would you like to plant something too? Richard found himself accepting a small seedling and following Lily's gentle instructions about proper soil depth and watering techniques. As his hands worked with the earth for the first time since childhood, he experienced an unexpected sense of peace that had been absent from his life for decades. This plant will help people with heart problems, Lily explained as Richard carefully patted soil around the roots. But it needs patient love to grow strong, just like people do. That evening, Richard sat in his office staring at the small potted plant on his desk, wondering how an 8-year-old girl was systematically dismantling everything he'd built his life around. Lily's approach to medicine represented everything his industry opposed: natural, unpatentable, accessible, and based on knowledge that couldn't be controlled or commoditized. Dr. Vasquez's latest report confirmed what Richard already suspected. The children receiving Lily's herbal treatments were not only showing better clinical outcomes than those receiving standard care alone, but they were also requiring significantly fewer expensive interventions and shorter hospital stays. Dr. Blackstone, Dr. Vasquez said during their video conference, "We need to discuss the implications of this research. If these results were published and replicated, they could fundamentally change cancer treatment protocols." Richard understood the unspoken threat. Medicorp's business model depended on expensive synthetic drugs that patients needed for extended periods. Effective herbal treatments that families could grow at home would devastate pharmaceutical profit margins. "What are our options?" Richard asked, though he already knew the answer would force him to choose between financial interests and human welfare. We could attempt to discredit the research, claiming insufficient sample sizes or flawed methodology. We could try to patent synthetic versions, though our tests show they're less effective than the natural preparations. Or ... Dr. Vasquez paused meaningfully. Or we could acknowledge that this 8-year-old has discovered something our industry needs to learn from, Richard finished quietly. That night, Richard made a decision that would transform his life as dramatically as it would impact his company. The next morning, he returned to the hospital not as a pharmaceutical executive, but as someone genuinely seeking to understand healing from a completely different perspective. He found Lily in her room, weak from her latest chemotherapy treatment, but still tending to a small herb garden she'd created on her windowsill. "Lily," Richard said, sitting carefully beside her bed, "I want to learn everything you can teach me about helping people with plants, not to make money, but to really help them." Lily studied his face with the uncanny perception that serious illness had given her. "That would make the plants very happy," she said softly. "They've been waiting a long time for someone important to listen." 6 months later, Richard Blackstone announced the creation of the Chen Foundation for Integrative Medicine, funded by his personal fortune and dedicated to researching traditional plant-based therapies alongside conventional treatments. The foundation's first project involved establishing medicinal gardens at children's hospitals across the country, staffed by both trained botanists and traditional healers like Lily's grandmother. Lily, now 9 years old and in complete remission, became the foundation's youngest consultant, traveling with her grandmother to teach other families how to grow healing plants. Her original herb garden at Boston Children's Hospital had become a model for similar programs nationwide. "Dr. Blackstone," Lily said during the foundation's inaugural ceremony, "are you happy that you learned to listen to the plants?" Richard looked around the transformed hospital garden, where dozens of families were learning to cultivate their own healing remedies under the guidance of traditional healers and modern scientists working together. "Yes, Lily," he replied, understanding that his greatest pharmaceutical discovery had nothing to do with laboratories or patents. "Learning to listen has been the most important research of my life." Medicorp continued developing synthetic drugs, but now also supported research into natural therapies and traditional healing knowledge. The company's profits initially decreased, but Richard discovered that success measured in lives saved rather than dollars earned provided a satisfaction that decades of financial achievement had never delivered. Lily Chen's herb garden had done more than cure cancer. It had cured a pharmaceutical king's blindness to healing traditions that existed long before his industry was born. And in learning to see through the eyes of a sick child who refused to accept that effective medicine had to be expensive, Richard Blackstone discovered that the most revolutionary breakthroughs often grow quietly in the soil of ancient wisdom, waiting for someone humble enough to kneel down and listen to what the earth has always known about healing. 2 years later, the Chen Foundation's integrative approach had been adopted by over 200 hospitals worldwide. Lily, now 10 and cancer-free, continued developing new herbal formulations while pursuing her education through a special program that combined traditional botanical knowledge with modern scientific training. The little girl who had shared her grandmother's special tea with fellow cancer patients had grown into a young healer whose influence extended far beyond hospital walls. Her story inspired a generation of medical professionals to reconsider the artificial divide between traditional and modern medicine, proving that the most powerful cures sometimes begin with the simplest act of caring enough to share what you have with someone who needs it. Richard Blackstone had built his empire by believing that healing could be owned, controlled, and sold at premium prices. But an 8-year-old girl with a handful of seeds had taught him that the most effective medicine in the world grows freely in soil enriched by wisdom, watered by compassion, and harvested by hands that understand that true healing belongs to everyone. Thank you very much for listening. Please let us know what you think of this story in the comments. Don't forget to like the video and subscribe to the channel. Turn on notifications so you don't miss any other videos.